My name is Tyler. I'm with Occupational Therapy. I'm going to instruct how to connect the Hoyer lift sling to the actual Hoyer lift. So first thing you want to ensure is that the bed is at appropriate height to allow clearance for the wheels of the Hoyer lift. Once you've achieved that height, begin to align the Hoyer lift to over the center of the patient. You want to remove these guardrails so they don't interfere with lifting the patient. As you place the Hoyer lift over the center of the patient, you want to lower the lift bars here, and you can see that there's a small image indicator that indicates which bar is going to be connected for the head portion of the sling and which bar is going to be connected to the feet portion of the sling. You want to lower the sling until you're able to connect all straps. So once your sling is lowered, hang up the remote and place the slings onto the latches. You may have to, do some turning of the sling bars to ensure that you're reaching the actual sling hoops. And make sure that the clasp here comes down to lock in the hoop. And now we're going to make sure that the leg straps are threaded between each other and crossed as we apply them to the Hoyer lift. Sometimes with some of the larger patients, you may want to place a towel or a sheet here at the groin area to avoid further pinching. You come back to the remote, lock the Hoyer lift in place, widen the base of the Hoyer lift, and begin to lift the patient from the bed.
Uh-oh, what happened to your patient?
Now that the patient is clearing the bed, you want to unlock the Hoyer lift wheels, lower a bed rail if needed to ensure no obstacles are obstructing the path of the patient. As you remove them from over the bed, you may want a second pair of hands to ensure the safety of the patient's feet. Be mindful that the patient's head does not swing to hit the base of the Hoyer lift. The patient can place their hands onto the Hoyer lift bars to ensure safety of the upper extremities.
But don't pull on this. This is not to pull down on.
As we back the patient off the bed, we want to start to turn the Hoyer lift. And start to get the patient into position, turning their body within the sling. going to continue to turn the patient. Ensure that they don't bump their knee here on the mechanism of the Hoyer lift. With the base widened, we're going to approach the chair. Now that the patient is safely hovering over the chair, we're going to lower the patient into the chair. On most slings, there is a strap at the back to allow you to pull back on the patient to ensure a comfortable fit. In some cases, it's beneficial to stand in front of the patient to push the patient back so they're as far back into the chair as possible. Lower the lift bars until there's slack within the hoops, then remove the hoops from the lift bars. Unlock your Hoyer lift and back away from the patient. Be mindful of the patient's lower extremities to avoid injury.